EU regulators are recommending the emergency use of Moderna's coronavirus vaccine, setting the stage for approval. The EU has ordered roughly 80 million doses of the Moderna vaccine. Meanwhile, second doses have already begun here in the U.S. for those vaccine recipients who were among the earliest to get it in the U.S. Let's bring in Dr. Shereef Elnahal. He is University Hospital CEO and former New Jersey Health Commissioner. Doctor, it's always good to talk to you. The last time we spoke, we were talking about your hospital preparing for these vaccine deliveries and making sure the administering of those vaccines was a smooth process. How has the process been so far for you? As you hear nationally about the bumps in the road here, I mean, how does that compare with the experience you've had so far?
Thank you so much for having me. So we've been now at this for several weeks at University Hospital. We vaccinated the first person in the state of New Jersey and have since been doing hundreds of vaccinations per day at our hospital. And we had the advantage of being able to work directly with the state health department, but also several weeks of diligent planning to make sure the actual administration efforts were efficient. We are able to do 4 essentially assembly line style lanes where folks register. They get the injection. They're observed by about 4 or 5 nurses walking around a total of over 40 chairs in our setup. And then folks have to, of course, get their next vaccination appointment because these are 2-dose regimens. And so we now have the capability of scaling this model for efficient delivery. And unfortunately, I think what you're seeing nationally is that a lot of folks did not have enough time or support from the federal government to be able to set up an efficient administration system. We can't just expect states and hospitals that may be under-resourced and not have enough time to plan to be able to do this efficiently. And so I do hope, especially after January 20th, that much more federal assistance and in some cases entirely new federal vaccination sites, especially in underserved areas, will be set up.
Dr. Elnahal, I know that we've heard reports nationally of not just people who are sort of stalking pharmacies for, trying to get ahead of that line, but also a drop in demand for some of the priority groups. So between both of those, what have been your observations and what are solutions to some of these issues?
Well, this is a push and pull, Anjali, around, supply versus demand and prioritization, which is complex. Remember, we're still in phase 1A, which is healthcare workers in hospitals, in nursing homes, and long-term care residents. So we cannot vaccinate the general population outside of those categories yet, according to the federal government. States, of course, solidify those requirements. What we really need to do is make sure we're opening up to all phase 1A healthcare workers, even if they're not employees at hospitals or clinics that are getting these vaccines. That has to happen as soon as possible to make sure that we're actually getting through that very first area of prioritization. But I do think we need to move very soon into 1B and 1C to make sure that we're making good use of all of the vaccine stock that's being shipped nationally.
Doctor, you talk about the urgency here on that front, and I wonder how much of it is made more urgent by the fact that we're seeing this UK variant just rip through that country as they are now in the 3rd national lockdown there. I mean, the numbers are pretty terrifying. 1 in 30 people in London testing positive, I think in large part due to this variant we've been discussing that spreads more rapidly. We know that's here in the U.S. I mean, testing is limited in terms of trying to figure out how much it's spread already in the country. But if you pair those things together, along with the risks that maybe some of these vaccines could prove to be less effective than hopeful when you factor in mutations as well, I mean, how do you look at all that and judge how worried we should be as a nation when you put those factors together?
I agree that it's concerning. These 2 variants are much more contagious. They spread significantly more. And in fact, the studies that are happening in the UK showed that mutant variant became the dominant variant in just a few weeks after it was discovered. And so it's going to be the dominant virus likely in the US in the next couple of months. What all that does is impress upon all of us to make sure that we are really ramping up our vaccination rates, making sure we get through these priority groups and then to the general population as soon as possible. The best analogy I've heard is that vaccination is a fire hose and the virus is a fire that is spreading. And what you're seeing now with these new variants is that fire is going to spread much more quickly. And so we really have to step it up. We need much more federal support to states and healthcare systems to really ramp this up. And we need quick action from the CDC for us to be able to proceed through these priority groups.
Dr. Elnahal, I'm glad you brought up that federal support, because we know that right now we're waiting, and to your point, waiting for the next administration to come in and sort of put into action some of the ideas and strategies. We also know last month that health experts were warning that mid-January was going to be the peak. So there really isn't enough time to prepare for that right now. But in the aftermath of that, what are you expecting to be sort of the immediate policies that come out to help curb the continuing transmission?
I think it's a great question, Anjali, and I know that there's very diligent planning happening right now on President-elect Biden's transition team on this. We need to think about the country in several different spectrums about preparedness to deliver the vaccine. Some places like New Jersey have been well equipped and are well resourced to be able to administer these vaccines more quickly, whereas you have other parts of the country that simply do not have the resources, do not have the funds, and do not have necessarily the healthcare personnel and the large facilities that you need to do this, especially in the winter. And so that's really where the federal government needs to step in, make sure that we have the infrastructure needed to vaccinate the entire population. Because remember, this is a game not only of getting yourself the vaccine, you're really only protected, and we can really only start to dial back these restrictions when 70–80% of the population is vaccinated. It's never been more clear that the health and well-being of your colleagues, families, friends, and everybody in society has a direct impact on you. And so I know that, again, the president-elect and his team will make sure that happens.
I know you mentioned earlier underserved areas and really, rolling out the vaccine in those areas. A majority of that is minority populations. And I wonder, we've had so much discussion about vaccine confidence. We've already seen the reports now of those side effects, whether they are immediately after or delayed. Is there any movement on that within your system when it comes to messaging or anything that you've seen that works to overcome that?
Again, a really important question. So one thing I want to emphasize is that, of course, it's going to be tempting with all of the pressure to get people vaccinated coming from all directions to simply skip over people who are hesitant and go to others. Again, that strategy is not going to work, and it's especially not going to work in communities of color that have been devastated by this pandemic. And so what we really have to do is make sure that every level of leadership, especially in healthcare systems, are approaching communities humbly, understanding that there's a history of systemic racism in these communities from the medical establishment, but also listening to very legitimate concerns. I mean, one example is, why were we able to mobilize such an effective vaccine, a set of vaccines really for this virus, and have not really mobilized for other problems, health problems or otherwise, that have plagued these communities for decades. And so we not only have to do that and promise to these communities that we're going to follow through with other healthcare conditions, but really, again, just listen and make sure that we are hearing these concerns and addressing each of them systematically.
Yeah, obviously a very urgent situation, made more urgent there in those communities most impacted by all this. But Dr. Shereef Elnahal, University Hospital CEO and former New Jersey Health Commissioner, appreciate you coming on here to chat that with us alongside Anjali Kamlani as well.